there should probably be black box warnings on alcohol. Recent things coming out about it leading to 7 different types of cancer.
Plastic surgeons, you go through 4 years of med school, ideally 6 years of training. So that's 10 years. That's like if you fast track everything, right? And then you get out and you're offered $120,000 a year. That does not make sense.
The fatter you get, you're going to have all these hormones that are disproportionately secrete, causes increased breast cancer with a higher BMI.
And all types of cancers.
Yeah.
There's like another study with like 17 different types of cancers in young people.
I quit drinking 3 years ago and I couldn't be happier. My brain functions better.
Welcome back to the Doctor's Life podcast, where you get a physician's perspective on things that are going on. Today, we're going to kick it off. Let's talk about the Ibogaine. It's hallucinogenic. It was recently mentioned on Joe Rogan podcast with like the governor of Texas, Rick Perry, discussing it mostly for veterans, right?
Yeah.
I looked at the study they mentioned. It's published in Nature Medicine. So that's like, even when I was in academic medicine, if I were to get any paper published in Nature Medicine, I would be like, I've made it. Like, there's not much topping that.
There was a TED Talk on it too.
Was there? I didn't see the TED Talk.
Yeah.
So did you get to look up that paper?
I didn't look up the paper, but the TED Talk kind of goes over a lot of the results and stuff. Governor Perry actually talks about how his wife, like, went and got treatment in Tijuana.
Yeah, going to TJ for hallucinogenics is kind of insane, especially coming from like a pretty extreme conservative.
Yeah, that's what he
Republican.
says. Is like he is such a conservative, and like, you know, especially talking about these psychedelics. And
I didn't have to even mention it. Like growing up, it was just like, those are the people that are fighting any legalization of any type of medicine. So like he repeatedly states it. It's like, oh no, I know what your political stance has been your whole career. Yeah. So it's like, coming from somebody like that, it's pretty profound. So I was looking at the research until this one. Majority of the research is about substance abuse. Yeah. And breaking addictions. Like we've talked about like semaglutide assisting in that, and even things with like cocaine, crystal meth, tobacco, like semaglutide as an adjunct to cut the substance abuse is like very effective. Yeah. But that just gives you like an added percentage chance of being successful. This stuff just seems to be like, okay, you know, just make sure you take it safely and you're good. And it's decades old research that just like going back and all of it, like the results are pretty crazy. Like, how effective it is.
Well, Governor Perry was saying his wife came, she was on, was it Celexa? And he's like, she wouldn't be able to stay a day without it. And like, she got the treatment over a year ago and she hasn't taken a single Celexa without any of the mood changes.
What is Celexa?
Celexa is like a SSRI.
SSRI?
Yeah.
Okay. Yeah. So that's another thing I wanted to get into is, so it's been studied for a while for substance abuse. Yeah. Kicking habits, stuff like that.
Do you know how it was found? No. Do you know who discovered it?
No.
So it was like, it's actually pretty interesting because it's like a 19-year-old heroin addict and and like his friends like, oh, try this stuff. It's, you know, you're going to trip for like 3 days. Took the stuff and he woke up and he's like, you know,
I don't have an urge.
Yeah. He didn't have an urge to take heroin and he hadn't taken it for a few days. And he was like, oh. And then he started, you know, having other people try it in the addict community that he was with, and they were having the same effect. And that's where it took off. And it's like from some bark of some tree from like Central Africa or something. It is like it's a psychedelic drug, but with appropriate dosing.
It's appropriate dosage, and making sure you have the right people looking after you.
It does slow down the heart rate.
Exactly. It's like, but a lot of medicines people take have that QT interval prolongation. Yeah. So like
your antiemetics.
A bunch of things that like any like cardiac meds are on. Yeah. A lot of the psychiatric medications, they come with that label. Yeah. If you supplement with magnesium, it supposedly like brings that down to like very low chance. Yeah. And the dosage for it to have these like clinical effects are much lower than like what it's going to really take to like stop your heart or slow your heart.
And so what's made it hard for, it to become mainstream? It's an old drug, but they made it a class 1 drug, which made it impossible to do any research studies or anything with it.
It was just deemed that it has no clinical effects.
Yeah, no clinical effect.
The thing though is like this whole time, like we say this whole time, I hadn't heard about it since recently, and then like just like dove into it, and it's just like the addiction problem is huge, especially like trying to get out of the opioid epidemic.
Yeah, which is the biggest problem with the oxycodones and stuff, and it's just being able to kick that.
That's one main thing. Yeah. And there's a lot of people that fight addictions with liquor, where alcohol, where even if it's not clinical, it's still like you're probably drinking more than you should. Yeah. But outside of that is how many people are on antidepressants, anti-anxiety medications? Because like a lot of like what they talk about is for like veterans. And a lot of times, a lot of medicine comes from Department of Defense, and like whether it's surgical or medical, it's like, okay, these are the people that need it most, which they do. They're at the extremes. But it's so applicable to your like everyday working class female or male that's like just you're just prescribed Cymbalta and get on your way. Yeah. You never think of like, okay, what are
it doesn't really cure anything.
Maybe mass disorders. I really don't think it does that good of a job.
Well, obviously not, since like our veterans are, committing suicide 20 plus a day.
Any of the medications we have for any psychiatric disorder, I'm not saying like disease, like disorder, like you're just off a little bit, whether it's anxiety, feeling depressed, like stuff like that. Not to mention like schizophrenia. Yeah. Do we have a good medication for schizophrenia?
Oh, no.
Like, no. You might be able to like shut somebody's brain down so much that they don't think at all, but like,
especially with psychiatric issues, we got to find cures. We can't find, and we got to have stuff that, you take a shot or a pill that, is going to be effective for months at a time, instead of like something that you take every day. Because,
for the rest of your life.
Just look at the people that are doing it. You're either building an addiction in someone that's already depressed or anxious and stuff, and like taking these medications. For the drug companies, it's great. They're
perfect.
They're just making hundreds of $millions a month on just the one drug. Yeah. Forget about all the rest of them that are out there, and like it's compounded with so many people taking it. So
it's kind of crazy how like ineffective it is, how lucrative it is. Yeah. Usually most systems, like you have to be pretty effective to be lucrative.
Yeah.
But like coming back to that study that was released last year, which was like a week ago. So the substance abuse thing has actually been documented for years now, but they looked at 30 veterans with TBI or traumatic brain injury. And the first thing they looked at is functioning. I had to look at the results repeatedly because it's not like a little bit better. And they're just like, okay, well, it's a little bit better, but it's statistically significantly better. Like it was just like eye-popping, like, oh my God, like they're like doing a lot better from baseline.
And it's with a single treatment, right?
Yeah. And it's then with a single treatment, like single treatment, and then with the second treatment, it goes like
exponentially. Yeah. Compared to like, people get on methadone and stuff, and you have to be on that. All it does is it gives you the same effects without the euphoria.
Yep.
Or the
yeah, exactly. But it has side
doesn't
effects
really
too,
do much. Yeah.
with like bone density, losing your teeth, like you're just not a healthy person on methadone.
Yeah.
But on top of like just the functional recovery after the TBI, stress, anxiety, depression took a nosedive after this treatment. Again, it's not like a little bit of improvement. It's like, it's so drastic. Like it needs to be like implemented pretty well. There should be organizations like the NFL, NHL, even boxing organizations that should be funding studies on this.
Yeah.
Because it improves like a lot of neural pathways.
Yeah.
It promotes white matter growth. It's been shown on like imaging. It goes like kind of in a trend of like what we've been seeing with like psychedelics or like psilocybin, even ketamine treatments, things that have been like shunned for a long time, where it's just like, hey, just try it out. And like, even as a medical professional, like even if I see a family member suffering through this, I can't like be like, this thing might help you. Better than anything else I've seen might help you. But I have no way to do that or even try it out.
Yeah. And like sometimes it's like the physicians that are trying this stuff out, they're like shunned and looked down upon. And like you almost can't carry like an MD behind your name because
you're risking board certification, like you
losing
can
your
get
license
that revoked.
And
yeah.
But like, these are the guys just making incredible ways for like people to heal.
Yeah.
And with one of the biggest problems, well, multiple big problems, the whole psychiatric and behavioral health problems with something that's, I think, is pretty cheap to make. Psychiatric's part of that whole depression, but also like TBI and also the addiction stuff that's going on. So
it's huge. Just think addiction, depression, anxiety.
Yeah.
Like if you get those three things, like even if you make a 10% dent on each one of those, it would make a huge difference.
But like there's only like what, 3 or 4 clinics in the world that actually are doing it. It's like not many, and it's something that definitely needs to get a push. I really believe in the psilocybin studies and MDMA studies that are, the microdosing, but this seems like it's at another level with the cure.
I'm willing to bet some people respond to things in different ways.
Yeah.
And because like the brain is so complex, like it's not like one treatment for all, but each individual is going to respond differently to each thing. Like if you're monitored accordingly, you should be able to experiment and be like, oh, what works for me?
Yeah.
Rather than like, okay, but it's what's going on anyways, right? Whoever's prescribing you medications, like, oh, you don't respond to this SSRI. Let's switch you over to this one. Let's switch you over to that one. But it's all like pharmaceutical grades.
It's being able to find the appropriate places, setting up the appropriate places to be able to, like we were working on a wellness center for the veterans ourselves. And like, this is something I hope that we could possibly add on with doing, but there's so many regulations with trying to get some of this stuff. But I would love to be able to do it.
If it wasn't for the career risk, we'd start this up tomorrow.
Yeah. The thing it does is like, it's not just helping one person or a small group of people. We could have an ultimate effect on such a huge population.
Especially if it's like 2 treatments.
Yeah.
Yeah. 2 treatments gets to like 97% efficacy.
That's not what the pharmaceutical companies want to hear. And then if it could decrease alcoholism, leads us to our next thing, which there should probably be black box warnings on alcohol, with recent things coming out about it leading to 7 different types of cancer, which we kind of know about, like esophageal cancer, prostate. I don't know exactly which 7 they said, but esophageal cancer or probably pancreatic cancer or liver cancer.
Esophageal, oral, liver, pancreas, all makes sense. Right?
Yeah.
Pancreas, liver, all like help break it down. Your esophagus, oral stuff is what goes like in direct contact. And we just seen our patients, it's like that need reconstruction or head and neck from cancer. All of them are drinkers.
And it's not like with you going and having one drink. I quit drinking 3 years ago and I couldn't be happier. I just think my brain functions better. I don't find a need or use for it anymore. I drink caffeine instead. Like I'll have a double espresso instead of like having any drinks when I'm on vacation or anything like socializing event or anything. I'll have coffee instead of anything like that. And I used to look at my friend, I'd just be like, why is he drinking Red Bull and not drinking? And it kind of makes sense. Like caffeine helps you sometimes relax a little bit too. And just helps you think clearer. I think it helps with socializing. Different things help different people. So,
exactly. Everybody responds differently.
Yeah.
But if you drink more, you need more caffeine too. So if you're having like 4 double shots of espresso and a couple of Red Bulls.
We got to always think of this as like, why do they say it causes 7 cancers? Is this bullshit or like, what are they? And you got to just think about it. You're putting this poisonous material in your body, you know, like people are like, oh, don't call it poison, but it is poisonous material in your body. It's going to change over time.
Used to like draw it as like the skull and crossbones on a bottle, you know?
And this is why we talk about whole foods and not processed foods and stuff. It's going to change your DNA, and it's going to change your DNA over time. You're going to have these breaks in your DNA and where it throws your entire mechanism and your bodily functions out of whack, where you're not able to control what's growing in there. And once that's thrown off, and for some people, their immune systems or their cells are thrown off a lot easier than others. And your DNA could be different where you're just like that one step away from getting cancer. And like that, you know, either smoking a cigarette or drinking alcohol, it's going to push you right over to getting cancer.
So there was a recent study with studying like fat cells with the DNA. It's like once you're overweight, the DNA expression changes.
Yeah.
And so that's why the propensity to regain weight after weight loss is so high, because I don't know what the length of the study was, but I'm sure if you do it long enough, you can get like that switch. But like the DNA in like your everyday cells, the expression is like it wants to restore the fat. It wants to regain the weight.
With fat, like the fatter you get, you're going to have all these hormones that are contained in the fat that are going to, you know, disproportionately secrete and cause the different types of issues you have. Like it causes increased breast cancer with a higher BMI.
And all types of cancers. Yeah. There's like another study with like 17 different types of cancers in young people.
Yeah.
Despite early detection and early cure, morbidity is starting to go up, which is kind of nuts.
For a lot of people, that I would like it to be a lot easier to be able to propose. And I do want people to start doing like, they should probably do a 24-hour to 76-hour fast, like a water fast or like something fasting mimicking like 3 to 5 days before starting one of the GLP-1s and stuff, because that's going to clear out the systems. So they kind of clear out bad cells and stuff, and you're going to get on this fat loss journey. So it'll kind of clean up your DNA, and you start your GLP-1. So you continue to lose weight with the GLP-1s and just continue on that path, because people think the fasts are long and it's impossible, but it's very doable.
It's one day at a time. You do some
just
one day and then like a little more each day. It's more tolerable. Like, you don't really think about it. It's not for everybody.
New Year's resolutions.
There we go. New Year's goals. Like where are we going with the New Year's? What are things you're excited about in 2025?
Some of the things are, you know, just Trump taking over.
Why?
RFK getting into that position, I think. Like,
so why? Because people hear that, they're going to be like, oh, these guys just Trump supporters.
Yeah.
Blah, blah, blah.
Just the economy getting better. Like, I think a lot of the Middle East issues are going to settle out. A lot of the stuff that we see, I think will get more of a stronghold. But also, like, all the staff he's putting into position. And last time he did it, but we didn't think too much of it. But this time he's making even more drastic changes with like RFK and bringing him in the position of like changing a lot of healthcare, going away from being sick care to well care.
Yeah.
Is
just preventative, like actual preventative rather than like screening preventative, actually preventing these disease. So I'm going to take the other side just so people have a better understanding. They're going to hear you say this stuff and they're just going to be like, completely shut off.
Yeah.
And your response is naturally going to be like, well, I don't care what you think.
Yeah.
This is just how it's going to be.
Yeah.
But let's look at details about economy being better. Why do you see it? Like in what ways? Like how do you see his proposal? Because people keep pointing to like tariffs being inflationary.
Yeah.
That driving like markets down, driving everything down.
He's trying to bring business back to the U.S. So just opening up more factories and for small businesses and making businesses happen here instead of bringing everything from China and selling that. It's going to make it more where...
Doesn't that drive up costs?
It does drive up costs, but you also have more people employed and working rather than bringing in, robots to take people's jobs.
But they are bringing in robots.
Yeah, that's going to happen anyway. But on top of like getting stuff from China. So
the thing I'm mostly hopeful for is obviously people are going to be like, oh, okay, they're higher earning individuals, so they're going to say this, but like decreased regulation is going to promote higher GDP. And that's the one way to fight overall inflationary pressures.
Yeah.
But I'm hopeful for that. We'll see what happens. And like you were mentioning the cabinet positions, RFK, Tulsi Gabbard, these are both career-long Democrats that are appointed in but
Tulsi Gabbard's a very interesting person.
But she was until recently lifelong Democrat.
But she left it for got to listen for her reasons that she left.
And it's the reason I don't vote blindly Democrat anymore.
Yeah.
But outside of that, there's a lot of positions, people he's proposed for positions that are within between 40 and 55 years of age, which is completely different from the prior administration, even his own prior administration, which is always like 60 to 70, where we're actually seeing people that are 40 to 55, 40 to 60, not just for like the say they have in this government, but those are going to be some of the leaders in the next election and the election to come. So it's not like setting up another like 70-year-old candidate, 80-year-old candidate. Like that's something like just raw data. I'm like, I can stand behind that. It's just nice to see a change. That's part of my hopefulness. But on a personal level, what's coming up? What are you looking forward to?
I got a lot of stuff going on. So to ramble them off, I got a couple of houses that I'm building, the beautiful work of my wife and our construction crew. And then we got our symmetry design. And then
give them a proper shout out. Symmetry design builders.
Also building the surgery center with the same construction crew, which they've been doing a great job. And the
timeline's kind of crazy. I was just like, you say like 8 to 12 months. I'm like, this is going to be like 12 to 24 months and then add 20%. It's just like, oh no, they meet deadlines.
Yeah, no, they make it happen. And then, you have my wife looking over it. So she makes sure it's like not too far off the timeline. Other things, surgery center, I think we got a lot of places. I'm also doing a few other things on the side. I think making our own supplement line is going to be pretty big, which like we can help a lot of people in different ways. And it's just stuff that you want to take every day. And it's coming from perspective of, I've been studying this stuff since I was in college. So, and I've pretty much tried most of the things and seen what makes a difference. And then with some of my friends with great minds in the supplement space.
Also
too.
minimizing the number of supplements you need to take. It's like one thing, two things, and that's it. Like,
it's just such a pain opening up like 20 different bottles to get, and you're like, all right, this one's got this stuff, but like I got to take this extra stuff.
This morning I took like 6 powders and 8 pills.
Yeah.
Why not put them together?
Yeah. Yeah. So I can't wait till the morning powder comes out. That's going to be phenomenal.
The people involved in that project are most excited about just being able to have access to it.
Yeah,
ourselves.
Exactly.
So that's the coolest part.
Yeah.
It's just like, one thing. I just need to take one thing a day. Like, just simplify it for me.
It's going to be something different, something great. And then we'll have other products that come that are just going to blow people's minds. So that's what we're working towards. And I'm always thinking of different ways of not just scaling my practice, but like different things I'm doing. Like moving further up the line with peptides and stuff, working on some things with that, some research in that aspect as well, to get better products out in people's hands and being able to get it out to more people like in a cost-effective way.
Able to make it affordable for more folks.
Yeah, and also researching it where a lot of places don't have you mixing too much stuff. So where you can blend a few of these products together that work really well synergistically to be able to make the right blend of that. So you're able to use it, just testing them out, just making sure it's the right blend. So you're not doing like 20 different pokes for your longevity or weight loss or whatever you're doing, and getting the benefits of the energy. And, I think one of the biggest things is going to be to make the blend where you are getting the GLP-1s or the Ozempics mixed in with something like a muscle building peptide. So, and also something that helps with healing and
what do you say? Like what type of muscle building? Like
growth hormone, something, in the realm of growth hormone. Having that all mixed together to be able, I think you could make a pretty
do it
powerful
in like a cost-effective way.
Yeah.
I mean, like right now, like obviously people can get that, and we do prescribe it for people, but for like cost-effective way where
for me it's affordable, but I look at it, I'm like, shit, even I couldn't do it for long term.
Like $500 a month,
way more than that.
At what level is it cost-effective where you can deliver semaglutide, CJC? It's gonna come. It's gonna come quickly too.
Yeah, it's gonna come from China
or Russia.
How about for you? What are you looking forward to?
Definitely the surgery center. I can't wait to get that going. It's kind of weighing the nuisance of, because like if you don't have your own center, you got to schedule somewhere else. So it's like we were talking
driving
about
around and lugging everything around us.
And we were like just talking about it. It's like you're at the mercy of any other surgery center.
Yeah.
And then they can run it however they want. And it's like, it's not what we want. Yeah. Like there's a certain experience we want our patients to have. Like we're not doing top-notch work to then get it like destroyed by some patient's experience in pre-op or PACU. Most of the places we are pretty good, but it's not your employee. It's not the way you want to set it up, no matter what. And also like just scheduling, you have to go with like the times they give you, they take away our block times. Yeah. So it's just having more control, which is going to be really good. And like, cause everybody's like, oh, you're going to make more money off the case. It's like, yeah, not necessarily. No. Cause like you give up that headache and the headache you take on is like, you got to staff a surgery center now. Yeah. Oh yeah. How about the hours it's not running or you don't have cases going? You got to take, again, that whole like, it's called running a small business, but this is like, I think on the cusp of going from small to medium size. Yeah. I don't even know what the definition of medium sized business is, like 300 employees. Yeah. So it's nowhere close to that, but it's taken that on, but it feels good. I hate to say it. This like the way like how optimistic I am of 2025.
Yeah.
The last time I felt this way going into a year was 2020.
Yeah.
I was dead wrong.
Dead wrong. Yeah. No, 2025 does look like a bright year unless we get spanked by something like COVID, you know.
Yeah, there's some like
yeah.
existential like threats
Yeah.
that can always like be a dinger. That's the main thing. The supplement line, I know it's going to be great because I just personally want to take it. There's a couple of tech things I've been following along and been probably going to dive a little deeper into. And you know me with like some crazy crypto stuff, but there's a couple avenues where I want to see how it flows. But then again, like that's also reflective of the incoming administration and the friendly regulation on crypto. We'll see if it happens, but it is definitely something like I'm keeping a close eye on. Trying to go less and less high risk going now that I'm like 4 or 5 years out. It's like you take appropriate risks and then like, cause I know in the next 5 to 10 years, I got to go low risk, you know, like kind of like steady growth, low risk. But like the first years I did my like high risk stuff and made some great moves, made some horrible moves, but
it's supposed to be the other way because you build the foundation with low risk.
No, it's supposed to be the other way. Well, everybody says whatever. It's supposed to be the other way because if you lose all your money earlier in your career, you still have time to build it back up. Where if you lose your money late in your career, like when you're talking about high risk late in your career, like you don't want to put like your retirement, your kids. Like
I'm saying, you already have your foundation, so like you're not risking the entire thing.
That's different. Like when I'm saying like high risk, it's like high risk. It's like there's no foundation. It's like risk on, let's go. What you would say is high risk once your foundation is established is probably like for you is still like low risk might be high risk for somebody else because it's going to be a significant portion of their net worth. There are a few things, and then just like from the like personal aspect of like getting into shape. We're only a few days into the new year, but I've worked out yesterday and today, 2 days in a row, first time in months. So I'm going to try to keep that going, like go like 4 to 6 days a week. Yeah. It's not like insane workouts, like, you know, like resistance bands going like 20 minutes a day. Yeah. Trying to throw in some yoga in there. Definitely some meditation. I have not been good about, but I want to make a point to do some nightly meditation and get Ari involved too. Yeah. Because I know she's going to benefit from it too. Just to be able to like reset and like recalibrate the brain. I
think if you buy the Neurovisor, you'll love it.
Neurovisor? Which one is that? I hadn't heard of that one.
It's like
it's another
flashing light. Yeah. So it's a flashing light.
How many of these things do you have?
No, I didn't buy it.
Oh, okay.
I tried it out at the A4M conference. So I tried 2 different versions. There was a guy, he was actually from Rhode Island, that he put us on this apparatus. I forget, it began with an E. It was like a Revivo or something. And it's this light. It just flashes and you have your eyes closed and laying down. And you could actually get like, they call it like a micro-dosing session with the lights. And like, it's
what kind
crazy.
Of light is it?
It's just this light that flashes at different paces. And like, you get all these like different like images. It's actually like the Neurovisor is like a small version of that, much cheaper. It actually gets you like sleeping like in seconds. It's seriously like, you can use it for sleep. You can use it for like the microdosing sessions.
How long?
All different. It's like 11 minutes. It was actually pretty trippy. I really liked it, but I'm like, all right, just buying another apparatus. But this,
you have so many.
Yeah.
How much does it go for?
For Christmas and stuff, they had it up for like $600 for where you get a lifetime membership, but you can buy it for, I think it was $299 or $399 for 1 year with the membership, or it's like $399 if you get, or $499 if you get a 2-year membership.
So all of them doing this membership,
this subscription thing. So yeah. So I'm like, I would just do the 1 year to see how long I use it and if I actually
Honestly,
use
it's kind of like, I don't know when people are going to stop going off of that subscription
Yeah.
model, like even like software as a service
it. Yeah.
or what's it, fundraising.
Yeah.
People outside get me trying to sign up for monthly payments. Like, no, I'll give you like 12 months worth, like right now. I
Yeah.
don't want to sign up for monthly payments.
Yeah.
It's like, nope, no option at all. It's like,
Because
dude,
they know you're not going to
cancel it. Yeah.
Yeah.
It's just like, you know what? I think it was like 2 years ago. Just like, it's a hard no.
Yeah.
Sorry. Like, if you want $50, here's $50.
Yeah.
I'm not going to sign up for $5 a month. It takes a lot. I still sign up for way too many things.
Yeah.
I say I have a hard line,
Yeah.
but I still have like way more subscriptions than I should.
Yeah. I just look at it and every few months go and cancel a whole bunch of things that are worthwhile.
Oh, I can't wait to start my online shop and like the appropriate promo people. Everybody's been getting paid monthly and I haven't done anything about it.
So what are your thoughts on private equity taking over like almost like all practices and stuff, or like trying to take over medicine?
Do you think they are?
I think so. Yeah.
I think they're trying, but do you think they will? I think there's kind of like balancing effects. It's going to just be private equity suing hospital systems and insurance companies and insurance companies suing hospital systems and private equity firms. It's going to be this like trilemma of lawsuits between three largely capitalized like structures just going at each other. So like with the No Surprise Act, the health insurance companies aren't holding their part. Like they are not releasing data because they're supposed to reimburse on their median reimbursement rate, right? And they're not releasing adequate data. They're not being transparent about it. Meanwhile, they're suing private equity companies because private equity companies are buying up large groups of physicians because that gives them deal power. Like, I have this many physicians, so I'm going to charge this much for my service. And which is like, if you have 70 physicians in a group, it's much more of a negotiating chip than two of us. Which
physicians weren't able to do on their own.
Yeah. So I'm actually like hopelessly optimistic that it actually will, with everything combined, will give this narrow window to benefit like small groups too. Yeah. But I don't know. I like, cause they're definitely like feeding off of everything and they're going to try to like take advantage of any small private group to make a buck. Yeah. So in that way, I'm not optimistic, but in the way that they can actually negotiate because of how large the group is. Yeah. But naturally for me, unless something is like well managed, a group that big is going to drop the ball somewhere. Yeah. I don't know. I guess that was like a no answer for me. Yeah. But I don't know what to think. It can't get any worse. It's like where I stand. I'm like, can't get any worse. And like, let's be hopeful. I'm down to back any private equity if they're trying to make a deal. I guess like with a health insurance system, to just be like, okay, they have their plastic surgeons, but I'm not going to be private equity owned. I know you're not. No. Like there's like, if you came to me one day, I'd be like, this is like the most shocking news ever. But maybe if I'm like 85, like I can't get my hands to do what I want, that they're willing to buy out something from me for some crazy amount of money. But like, I don't think the valuations are there for medical practices right now. I don't think the structures, like even for plastic surgeons, everybody's like, plastic surgeons make so much money.
I just think they've made a much bigger push at taking over plastic surgeon practices. And they have already bought out quite a few in Arizona. Yeah. And I've been getting approached.
Friends have been approaching me, being like, "Oh, you should join this." Like, no fucking way. Yeah. Like, there's absolutely no way.
And over the past 2-3 months, it's definitely come more aggressive and just repeatedly. And then like some of these guys that are sending me emails and texts and stuff, I'm finding them, they're presenting at like the ASPS or APS, which is the Aesthetic Society meetings and stuff. I'm like, and talking about private equity and stuff. They're probably trying to put their forks in people to try to get them to, they're marketers, so you got to take stuff with a grain of salt. They're salesmen to try to get you in their cloud.
Like I know new grads, plastic surgeons, you go through 4 years of med school, ideally 6 years of training. So that's 10 years. That's like if you fast track everything, right?
Yeah.
And then you get out and you're offered $120,000 a year. That does not make sense.
Yeah.
I don't know how like some of my friends are taking these deals. I'm just like, what do you like? Oh, it's incentivized, but like the first 2-3 years, you can't even hit those like realistically, like unless you do something crazy, like you can't even get a bonus.
Like location wise, they're driven by their wives or like
limiting themselves.
Driven. Yeah.
That is one of the main thing I've seen people like limiting their like income source is they're limiting the opportunities they're looking at. And also dependency. I was lucky. I had you like, you had everything set up or just came in and worked.
Yeah.
But it's hard to set up your own practice. And it's also hard to trust somebody to like build that up. I've seen people join others and do really well. I've seen others join people and
I've seen more just getting taken advantage of.
Yeah. And then they leave within 6 to 18 months.
Yeah.
It's just crazy when I just hear that like the going rate for a new rate plastic surgeon is like 120, 130K.
Yeah.
That's like your average NP or PA.
Yeah. It's like doing a super fellowship.
Just become a hospitalist, make like, or go IM.
Yeah.
There's good gigs. You can make like 300K a year and work half of the year.
Yeah.
Right. Like that's out there.
Yeah.
So it's kind of like people are selling themselves short, like big time. And then they're like just trying to outcompete each other. It shows within 12 months, just like there's your burnout. There's like, you're not getting paid what you're worth.
Yeah.
Like,
yeah. It's tough for physicians to build that confidence, especially like when you're like kind of beaten down for 10 years, going through, med school and then training.
But I think plastics is probably worse. I mean, I think it's partly based because we have such a big cash component. I don't think people think through the process of getting to profitability. Again, like small business management, like you got to consider yourself and your skill level as like, you have your LLC.
Yeah.
Like you have to think of that as the entity. And like, you can't have your entity taking $120K a year with potential.
But let's say you make $10,000, like for $120K, like cosmetic surgeries, like you're talking about anywhere between 10 to 20 surgeries will cover that salary, right? Yeah. So that's like, and that's like within a month you could pretty much like cover that.
Yeah. I mean, like let's say 25 surgeries will definitely more than cover that, right?
Yeah.
Even if you're like discount plastic surgeon.
Yeah.
So that's like one surgery every 2 weeks. Just doesn't make sense.
Double that for cost of, all you need to start is you need a front desk person and someone to schedule stuff. You don't need too many people to start your own practice.
I mean, if you're doing one case every 2 weeks,
you
could
just do one person.
Yeah.
Yeah.
Just put a fake mustache on top of your real mustache.
Yeah.
Come on, click this button.
Yeah.
It's not a high cost business. Obviously it grows to it.
Yeah.
Like what we have going is like, it costs a pretty penny to run it monthly, but you could grind it out and build it up as you go. Yeah,
you could run it very lean and like definitely don't need all the fancy machines, don't need anything like crazy. You could definitely start up with very minimal, like 50 to maybe 100 grand to start up, which you could probably easily get as a loan just coming out.
The physician's loan too. They probably have the best rates.
Start out on your own and just build from there. And I'm pretty sure like the first 6 months are going to be slow, but you know, you take a few calls here and there, especially with what they're paying stipend for a plastic surgeon. You could definitely run your office and pay your bills with just covering call for a week, you know.
And a lot of things I've heard from younger colleagues, they don't want to take call because even the stipend, they only get 30% of the stipend, which is just ridiculous. Like, just, I'm going to wreck my life, get woken up all hours of the night and just get 30% of this.
And these days, all you need to do is go to the hospital and ask for call, and you can pretty much be on the call schedule.